Hi everyone, my name is Abigail Bell and welcome to my presentation. The health problem I researched and studied was HIV and AIDS. HIV is a virus that attacks the body's immune system and is primarily transmitted through contact with certain bodily fluids. AIDS is the most advanced stage of HIV and neither have a cure. We see the main transmit of HIV come through unprotected sexual contact, followed by shared needles and even the mother passing it to their infants. My developing country I studied is Brazil. Next, my developed country is Greece. Finally, the United States is the last country I studied. Starting off looking at Brazil, it is located in South America. We see a lot of close living communities, which is important because the spread of HIV is through certain fluids. Next, the healthcare system in Brazil is a universal healthcare system. The main thing we are focusing on today from that healthcare system is that everyone receives free care provided by the government. Finally, Brazil is known for a distinct between the rural and urban areas. This didn't greatly affect how people gain access to treatment plans for HIV. To start off, we do see a slight increase in new cases in Brazil over the last 10 years. There are treatment plans available in Brazil, which are antiviral therapy known as ART and PrEP, what is a preventative drug. Brazil does offer free access to these treatments and drugs. However, the government funding affects the amount of these that are available. The amount of people living with HIV is and can be greater than the amount of treatment available due to the lack of funding. We see a stigma that lives within the country about HIV, which can prevent people from seeking treatment. Finally, in Brazil, people living in rural areas have a greater chance of spreading HIV due to the barrier of access to care. People living in rural areas may not be able to have the ability to travel to a hospital to get treatment or preventative care. Next, we are looking at the developed country of Greece. Greece has a national healthcare system, which means healthcare is free for everyone living in the country. It is located in Europe, which is a continent we see a barrier of location a lot. Just like Brazil, there is a difference in rural and urban areas and the ability to access care. Greece has a declining trend of HIV cases over the last 10 years. This is mainly due to the treatment plans ARCH and PrEP, a massive stigma living in Greece surrounding people who have HIV. This causes people with HIV to not get treatment and fear they'll be judged for having it. The government has played a big role in decreasing the stigma. They provide awareness of the disease and try to spread the knowledge of these treatments to the minorities living in the country. They make sure everyone is aware that there is a treatment drug out there to treat HIV. Finally, while looking at the United States, we know we do not have a universal healthcare system. Healthcare is not free in the US and is primarily paid through insurance. However, not everyone has health insurance, and we see that low-income families without insurance would have to pay out of pocket for treatments for HIV. However, another barrier in the US is a racial inequality. In the US, we see a great decrease in HIV cases over the last 10 years. This can be greatly attributed to the advanced technology the US has access to. The treatment plans of ART and PrEP are all available. However, they are very costly. One who does not have insurance may not be able to afford these treatments. This causes an economic inequality when accessing treatment of HIV due to it not being free. Along with the stigma of HIV, we see a racial barrier between white and African Americans. A quote from the CDC says, Black African American persons make up approximately 12% of the population of the United States, but account for 37%, 11,900, of the estimated 31,800 new HIV cases. The government has stepped up to raise awareness of HIV and the treatment options available. Groups have also got together to try to decrease the stigma surrounding HIV and increase access to care in the United States. I wanted to close off with the similarities and differences between the country's HIV cases. The first similarities is the stigma surrounding HIV. This causes people from all the countries to be afraid to seek treatment due to the fear of judgment. The treatment plans are also the same. There are the antiviral therapy and PrEP, the preventative drug. Finally, the governments have helped to raise awareness of HIV, trying to reach minorities and information about treatment. All in all, the differences we see between the countries are payment and disparities. First, payment in Brazil and Greece are both free of cost. However, in the United States, the payment options are either out of pocket or insurance covered. The disparities in Greece and Brazil are the difference in geological locations and being able to access care. Rural versus urban communities play a big role in this barrier. Finally, in the US, we see a racial disparity between whites and African Americans developing HIV, along with an economic disparity. As you look at all countries, there's an increase and decrease of new HIV cases throughout the years. Overall, we can see a global decline of these spreading disease. According to the HIV.gov, an estimated 1.3 million individuals worldwide acquired HIV in 2023, making a 39% decline in new HIV infections since 2010. Though there are promising numbers, but just looking at these three countries, there are still issues that need to be addressed. Thank you so much for watching my presentation.